Good afternoon, everybody. Today is our briefing for September the 2nd, 2020. And we have a lot to go over today and a lot of, I think, some hopeful news, but also some data we got to take very seriously as we move forward in the weeks and months ahead. So as of today, we have 10,728 residents that have tested positive for COVID-19. We have lost 222 residents to COVID here in Long Beach. It's the leading cause of death in our city. And we mourn and pray for every one of those lives and families. Of those, 143 of those deaths have come from long-term care facilities. Our positivity rate has significantly improved. It's now at 4.6%. And I want to talk about that a little bit later, but that, of course, is a number of positive cases that come back from our testing that we do. And the city just a couple days ago exceeded over 180,000 tests, 100 of those being city-run tests and the other 80,000 from different partnerships. That's significant. And I would, with certainty, know that we have one of the best and most robust testing operations of any city of our size in the state and probably anywhere. I want to also just note that Governor Newsom just recently announced his new blueprint for a safer economy. It's a color-coded system, which we're going to discuss in a minute. We are in the purple category, which is the most widespread category. We're going to discuss what it takes to get to red, what that looks like for us in just a couple minutes. But I want to start with some news that I know is important to folks. Because of where our positivity rate is headed and because of where the data is leading us, which I'm going to discuss right now as it relates to hospitalizations, we feel, and most importantly, the health department and Dr. Davis feels that beginning today, hair salons and barbershops can begin operating indoors at 25% capacity. Now, with that being said, we want to encourage the outdoor operation. So we know that a lot of barbershops and salons have moved outdoors. In fact, I got my first haircut at an outdoor barbershop since my husband's been cutting it, and just was right on the sidewalk and out in the outdoors in a way that was safe. Everyone was wearing masks, and it felt very safe. And so we want to encourage that activity, though we also want to allow barbershops and hair salons, if they want to work inside to 25% capacity, they can start doing some services in there as well. And there are ways also that these stores can look at their operating hours and so that they're able to expand some of their capacity. The health officer is expected to amend this health order later today in coordination with LA County and Pasadena, who also made the same announcements just today. And so all across the 88 cities in LA County, hair salons and barbershops will begin to have capacity at 25% indoors and as much as they want outdoors, as long as there's distancing protocols in place. Now, what does that mean for us? That action that we took on hair salons and barbershops completes everything that we can do in this purple category. So if you are another type of business, you're a restaurant, or you are a bar, or you are a different type of business that wants to do additional openings, it is not allowed in our category. So I just want to be very clear that we are in this category, and correct me if I'm wrong, Kevin, but for a minimum of 21 days, we will likely be in this category as new data comes out. And so that they're going to be looking at 2 to 3 weeks of data before you're even contemplated being moved to another category. And even if we do, we have to make decisions about what's safe. So let's explain these tiers. So the reopening, we used to be, we have determined reopenings for a variety of different factors. Now it's just 2. The state's looking at case rate and positivity rate. The state is guiding the reopening process. It's not cities as it relates to how fast we want to move. We can only operate in our tiered color. There are 4 tiers, and as you can see in this first image that's coming up. There's the purple tier, which is widespread. Then you have the red tier, which is substantial. You have the orange tier, which is moderate, and the yellow tier, which is minimal spread. I would say about over 80% of the entire state of California is actually in the widespread tier. And all of our neighbors, so Orange County, all our neighbors to the north, all of the Riverside, all these counties around us, we are all in the widespread purple category. What the purple category basically means is that we have a greater than 8% positivity rate. I just shared with you that our positivity rate was 4.6. The county positivity rate, which we'll talk about in a minute, the total is about 5%. And so we meet the greater than, we're less than 8%, of course, which we'll talk about. But they also want more than 7 daily cases per 100,000 is what the purple tier is. To get into red, you have to be between 5 to 8% and between 4 to 7 daily new cases. We do not meet that criteria, just to be very clear. We have a ways to go to meet that second criteria. So while we meet the first criteria in the state safety blueprint, we don't meet the case rate criteria. So that was the explanation of the tiers. This second image are the state indicators. And I want to just give you some information. First is the state is judging all of these reopenings by county. And so while the city has its own health department, and there are only 3 health departments in the state that are outside county systems, us, Pasadena, and Berkeley, we are counted as a county. So us and Pasadena are averaged into the LA County numbers. That's important because as we move forward, our reopening ability is dependent on the county. And to be clear, even if we just looked at the Long Beach numbers, we wouldn't be able to move any faster anyway. So that's not having a real impact on us and hasn't to this point. And so what are those indicators? As of today, the positivity rate in the red box, as you can see, is 5% in the county, and it's 10.2% is the case rate. So that's 10.2 essentially individuals per 100,000 of new cases. That number has got to drop significantly for any of LA County to move into another tier. So that's going to take probably a few weeks, but that's where we are. So the county as a whole has this 5% or 5% positivity rate, and the case rate's at 10.2. While the county's positivity rate puts us in the red tier, we still have, again, a ways to go. I'm sorry, while the positivity rate itself is in that red tier, the case rate is not. So that's why we can't move to the next indicator. So let's also talk about what else other requirements to advance are. You have to have a 21-day mandatory time between the tiers. So if you move to we're in the purple, you have to wait at least 21 days to move into the next tier, even if you meet the criteria. And you've got to meet metrics for 2 weeks straight. And you can only, of course, move 1 tier at a time. And data will now be produced by the state once a week. So they're going to run the data on Monday, and they'll post the data on Tuesday, and then we'll present the data to you weekly and see how we meet. I want to also just talk about the positivity rate calculation. Cities and counties across the state have been all looking at their positivity rate, and some have had different ways of measuring them. The state has asked for everyone in the state to align in this new system. So the city of Long Beach is aligning with the state on our new positivity rate ranking. This system also caused a small shift a few days ago into our positivity rate. So again, we are a lot lower, but the main reason why we are lower is because people in Long Beach are being safer. And so I just want to thank you, because the bottom line is less people are being tested positive for COVID today than they were 3 weeks ago, a month ago, 2 and 3 months ago. And so we are absolutely headed in the right direction here. And the only people that can screw this up at this point is us. And so we've got to make sure to stay safe and continue to get that positivity rate low, which will then ensure that our other metric gets lower as well. Want to go over some updated data. This graph that you can see is our COVID-19 cases by episode date. As you can see with this slide, we had certainly experienced a peak back in mid-July and early August. Since then, we've seen a steady decline, which is good news. And I would encourage us to stay vigilant so we can continue down this path. This next data point is our COVID-19 cases per 100,000. The slide shows the number of cases per 100,000. Long Beach is represented in the light blue line, and the dark blue line is the state, and the yellow line is LA County. The little dotted gray line is the city of LA, which is tracking very similar to the county. But as you can see, and by looking at those case rates, kind of where we are, we want to continue to lower that case rate. So we're tracking a little better than the county and our neighbors in Los Angeles, but certainly you look at the whole state as a whole is doing better than we are. I want to show you this next image. This is our deaths per 100,000. Again, Long Beach is in the light blue line, California is in the dark blue line, and the yellow line is LA County. Our case rate per 100,000 and deaths per 100,000 have been consistently lower than the county, but have been slightly higher than the state since the early days of the pandemic. So again, our data as it relates to deaths per 100,000, we've been doing, obviously the county has had more deaths per 100,000 than us. The state has had less, and each one of those lives has been very important and matters, of course, to families. This next slide is actually probably one of the better news slides. This is our hospitalizations over time. And these are reported daily, but of course they change over time as we gather more information from the hospitals. 3 weeks ago, the past 14-day average for hospitalizations was 77.9. Today is 58.8. So that's really good news. And it shows that we're seeing fewer people with severe illness, but we have, again, a significant ways to go. So one can say that we are on the right track again. That's because people are wearing masks and taking care of themselves, but we could easily go backwards if we don't keep it up. And this next image are active hospitalization trends. And this is just more to give you an idea. That blue line, that is community transmission. The yellow line are from our long-term care facilities. It goes to show you when this pandemic first started, a lot of our cases spiked in our long-term care facilities. Now those have really decreased. And we had less cases in community transmission from person to person outside in the city. That has been now the majority of our cases are community transmission. And we continue, and this is something that we really prepared for, to be prepared for any surges within our hospital system. Our hospital bed usage is at 50%. Our hospital surge beds available are over 330. We still have our convention center beds there just in case. And our percentage of ventilators in use is at 47%. And so we are working really hard with our hospital partners in sharing data and making sure that our hospitals have capacity. Having had a parent in a Long Beach hospital recently, kind of tell you they're working so hard. I'm just so grateful for them and for the amazing commitment to patient care that they employ. And this next slide shows our PPE inventory. As you can see, we have a lot of PPE in stock and have distributed a lot of PPE to partners, nonprofits, clinics, and so forth. So I want to thank you all for staying vigilant. Continue to distance 6 feet from each other. Continue to wear a mask. Wash your hands frequently. Sanitize high-touch surfaces. Our actions are saving lives. And a special message to our salon owners, our barbershop owners. We know that 25% capacity is also not ideal for you. We just want to ensure that we keep these numbers going in the right direction. And we're committed that in the next couple of weeks, if we continue to head in this direction, that those capacity numbers will also change for our salons and barbershops. And so, again, to everyone else, we've got to hold tight per the state. And it's going to take us 2 to 3 weeks to really assess where we are, and that's per the new state economic indicator that we cannot move any faster than we are. And so with that, I'm going to turn this over to Dr. Davis, who will have some more updates, and then we'll answer any questions from the press.
Thank you, Mayor. Good afternoon. I'm going to review some of the tier system information again. As the mayor mentioned today, and as we shared last week, the state has updated its process for allowing health jurisdictions to reopen certain sectors of the economy. These metrics are tied directly with the rate of disease in a community. Some of the previous indicators were more related to the healthcare and public health system's ability to respond, which was critical early in the crisis. The changes to the indicators mean that now only 2 metrics determine a county's readiness to move to the next tier. And those metrics are the new cases per 100,000 each day and the testing positivity. So jurisdictions in the purple tier, such as Long Beach and LA County, still have significant risk of COVID-19 community transmission. So to go further a little bit more into the new indicators of case rate and positivity rate, as the mayor mentioned earlier, and we saw in the previous slide, the new tiered system looks at 2 indicators to determine when counties can reopen. As part of Los Angeles County and along with Pasadena, we have to meet criteria for both indicators in order to move to the next tier. Although our numbers are combined with Los Angeles County and Pasadena's to determine our tier, I would still like to share how we're doing with these indicators as a city. So the first indicator is the positivity rate. Even before we implemented the new method for calculating the positivity rate, you can see that Long Beach has seen a downward trend in the ratio of positive cases in the last 2 months. And just of note, the change in calculation method was instituted on August 29th. The graph shows that our positivity rate for the city is currently at 4.6%. While the city of Long Beach is making strides in this indicator, we are still considered at high risk of widespread COVID-19 community transmission due to our high case rate, which is our second indicator. And again, we're assessed as part of Los Angeles County. Even though we're a separate health jurisdiction, synthesized data from Long Beach, Pasadena, and Los Angeles County, as reported by the state, is what determines our status. The daily new case rate for the city of Long Beach is 9.5 per 100,000. While the city of Long Beach has seen a downward trend in new daily cases over the past month, there's still work to do. We are the second largest city in the county, so our efforts locally help drive the numbers in the county overall. So it's important that we continue to do what we can to reduce transmission so that we can move forward with reopening sectors. So I'd like to turn to reopening of salons and barbershops. As the mayor discussed, under the purple tier, hair salons and barbershops are allowed to reopen indoors. And the updated protocols for these services will be posted on our website very soon. While our department director, Kelly Colopy, mentioned this briefly on Friday, I want to reiterate that the main reason hair salons and barbershops are allowed to reopen before other types of personal care services, such as massage parlors and nail salons, is the nature of the service provided. When you're getting your hair done, most of the work is done with the back of your head facing the stylist. So this means that each of you are less likely to breathe in directly exhaled air from the other person than you would if you were face-to-face in close proximity, as is typically the case for nail salons and other types of services. We understand the devastating impact closures have had on small and local businesses. And it's been said before, but I would just like to reiterate that these choices have not been made lightly. While this particular set of revisions has come from the state, the City of Long Beach supports Governor Newsom's reopening strategy. These choices were made with public health as the highest priority. So I quickly want to share some new guidance regarding day camps and child care facilities. The City of Long Beach is adopting CDPH guidelines around the use of cohorts for day camps and child care facilities. A cohort is a consistent group of children or youth and supervising adults in which supervising adults and children stay together for all activities and avoid contact with people outside of their group or cohort. Using cohorts minimizes the number of people exposed if there is a COVID case identified in a child, a youth attendee, instructor, or other staff. Cohorts should be as small as possible and no more than 14 children or youth and 2 adult staff. Programs should avoid changing staff assignments. All staff and children over the age of 2 must wear face coverings while in cohorts. These guidelines will also affect school programs once they're able to reopen. Lastly, I just want to talk about the Labor Day weekend and the heat. The city of Long Beach expects a hot Labor Day weekend with record-setting temperatures on Sunday. We're activating 5 air-conditioned cooling centers throughout Long Beach on Saturday, September 5th and Sunday, September 6th from 12 to 6 p.m. Those are at Admiral Kidd Park, 2125 Santa Fe Avenue, Houghton Park at 6301 Myrtle, Long Beach Senior Center at 1150 East 4th Street, McBride Park, 1550 Martin Luther King Jr. Avenue, Recreation Park, 4900 East 7th Street. All centers will operate in compliance with the Safer at Home orders to prevent the spread of COVID-19. Health screenings, temperature checks, physical distancing, and face coverings will be required. It's important to recognize the symptoms of heat illness such as dizziness, nausea, headaches, and muscle cramps. During high temperatures, it's important to remember to remain hydrated by drinking water before, during, and after outdoor activities. Try to avoid beverages that have caffeine or alcohol. As we enter Labor Day weekend, I want to remind everyone to celebrate safely and responsibly. We are making progress as a community, and we hope to continue to see improvements in our data. Please remember to wear a face covering while in public and limit your interactions with others outside of your household. Thank you.
Thank you, Dr. Davis. We will now take questions from the media. First question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hi there. The county announced today that they would allow K-12 schools to offer in-person services to special needs students in cohorts. You mentioned the cohorts just now. Is the city changing its health order to reflect that part too for special needs students? And when can parents expect to be able to participate if they have special needs students?
So we are aligning with Los Angeles County as regards to updating our cohort guidance for special needs students, those English speakers, English as second language speakers, and other students, other high needs students who may need intensive tutoring or specialized services such as speech therapy and services like that. So we are updating our protocols to reflect that, the expansion of those in-person small groups of students at the highest need to receive in-person services.
Thank you, Dr. Davis. Next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, I actually have 2 questions. So the first one is just a follow up on the last question. So can you share when parents may be able to take advantage of the on-campus services for high need students? And then the second one is if the city is planning any extra enforcement over Labor Day weekend for the Safer at Home order?
So as far as when parents can expect specialized services, we're updating the protocols now, and then right. And then that allows school districts and schools and other programs to decide if they want to implement these services. And we're just providing the safety and health protocols and precautions in order to provide the service safely. And then it's the schools that will come up with the whether they want to do it or which way that they want to go as far as implementing these services for students. Yeah.
I just want to add something to that because I think this is important. The ability for students to go back into the classroom, whether it's special needs or any other type of decision that's school-related, is up to the schools. So they will make those decisions. The health department only provides the framework as it relates to safety and the ability of a timeline for schools to implement. So there is a countywide type of timeline that the state's encouraging. The city's aligning with that. But we understand that the schools are taking a very cautious approach to which I support and we support to that classroom activity. So it's really a question in our case for Long Beach Unified.
Haley also had another question about enforcement and education over the holiday weekend.
I mean, the only thing I'll add is we've actually been stepping up enforcement, and we've been doing more enforcement. There's going to be enforcement this weekend, and we have continued to ensure that particularly businesses are doing a better job of staying safe. And I think part of why we're seeing some success is that people are being more responsible and businesses are being more responsible as well. So enforcement will continue.
All right, that concludes our questions. We will now move on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos a nuestro comunicado de prensa de hoy miércoles 2 de septiembre del 2020. Empecemos con datos generales. Hasta hoy, 10,728 residentes han dado positivo por COVID-19 en la ciudad de Long Beach. También aproximadamente 9,742 se han recuperado y desafortunadamente hemos perdido un total de 222 residentes de Long Beach por COVID-19. De esos 222, 143 de esos fallecimientos son asociados con centros de cuidado a largo plazo. Nuestra tasa de positividad a la fecha es del 4.6% y positividad. Y quiero también mencionar que el alcalde empezó hablando sobre la reapertura de salones de belleza y barberías. Empezando hoy, van a poder abrir al 25% y voy a entrar un poquito más en detalle en unos momentos. La semana pasada, el gobernador Newsom anunció que el estado se está moviendo hacia un plan para una economía más segura con un sistema codificado por colores de 4 niveles para determinar las operaciones y rastrear las tendencias de COVID-19. El movimiento del condado estará determinado por 2 criterios principales: la tasa de casos y la tasa de positividad de las pruebas. En la imagen número 1 que se mostró, muestra los 4 niveles de los colores, empezando con el nivel morado, que es el nivel extenso. Eso es una tasa de positividad más grande del 8% y más de 7 nuevos casos al día por cada 100,000 personas. El segundo, que viene siendo el rojo, es sustancial y eso requiere una tasa de positividad de 5 a 8% y nuevos casos de 4 a 7 casos por cada 100,000. Después baja a moderado, que viene siendo el anaranjado, y eso requiere una tasa de positividad de 2% a 4.9% y los nuevos casos de solo 1 a 3.9 casos por cada 100,000 personas. El mínimo es el color amarillo, que viene siendo menos de 2% de tasa de positividad y menos de un caso nuevo por cada 100,000 personas. Ahorita, el condado de Los Ángeles, el cual nosotros somos parte, está en el morado, que está el riesgo extenso. Tenemos Y vamos a hablar un poquito más sobre eso, pero la ciudad va a continuar monitoreando nuestra tasa de positividad y la tasa de casos nuevos diariamente. La fase de reapertura dependerá del número dado por el Estado para el condado de Los Ángeles, que juntará los datos recibidos por Long Beach, la ciudad de Pasadena y el condado de Los Ángeles. Quiero aclararles algo, la ciudad de Long Beach y Pasadena son parte del condado de Los Ángeles, pero manejan su propio Departamento de Salud. Entonces, reciben la información del Departamento de Salud de la ciudad de Pasadena, la ciudad de Long Beach y toda la información del condado, y eso se junta para salir con los números. Publicaremos el número del estado que se actualiza todos los martes en línea. Entonces, los datos los corren el lunes y se publican el martes y tendremos nuestros comunicados de prensa el miércoles. Como mencioné, el nivel más estricto es el nivel 1, el morado o violeta, que significa que el nivel de riesgo del condado es extenso. La mayoría de las operaciones comerciales internas no esenciales están cerradas y la tasa de positividad es superior al 8%. Ahorita estamos al 10.2% y la tasa de casos por 100,000 es más de 7 casos nuevos diarios. El condado permanece en un nivel más estricto si una tasa de casos y una tasa de positividad caen en niveles diferentes. Entonces, como se mostró en la imagen número 1, nuestra tasa de positividad está bajo los niveles del color rojo. Estamos a 5%, entonces estamos en el nivel rojo entre 5 y 8%. Desafortunadamente, nuestros nuevos casos por cada 100,000 no llegan al color rojo, que es entre 4 y 7 nuevos casos por 100,000. Estamos al 10.2 casos por cada 100,000. Entonces, aunque la tasa de positividad llega al nivel rojo, nuestros casos por cada 100,000 están al nivel morado o violeta. Entonces, tendremos que mantenernos al nivel más alto, que es el nivel morado. Según nuestros indicadores de estabilidad actuales, el condado de Los Ángeles, que incluye Long Beach y Pasadena, se encuentra en ese nivel morado, que es el más estricto. El condado entero tiene una tasa de positividad de 5.0% y una tasa de casos de 10.2 por cada 100,000, como mencioné. Nuevamente, estos indicadores incluyen Long Beach, el condado entero de Los Ángeles y Pasadena. Si la tasa de positividad de las pruebas del condado nos coloca en el nivel rojo y la tasa de casos de todo el condado está en nivel púrpura, vamos a mantener en ese color morado, violeta. El movimiento del condado es estricto y constante. Les mencioné la semana pasada que se tiene que quedar 21 días de espera obligatoria entre niveles. Entonces, ahorita estando en el color morado, tenemos que mantenernos ahí por al menos 21 días y cumplir con las métricas del siguiente nivel, el nivel rojo, durante al menos 2 semanas seguidas para poder ser elegible para movernos. También solamente nos podemos mover un nivel a la vez, aunque tengamos números mejores para bajar a otro color. Esto va a ser evaluado semanalmente, que se corre, como mencioné, la información el lunes y se informa el martes. Si no cumplimos con las métricas del nivel actual durante 2 semanas seguidas, podemos pasar a un nivel más estricto. Ahora voy a hablar un poquito más en detalle sobre la reapertura de los salones de belleza y barberías. Pueden abrir ahora, empezando hoy, en el interior al 25% de su capacidad, pero animamos a esas empresas que continúen brindando servicios al aire libre cuando sea posible. Entonces, para aquellos salones de belleza que ya pusieron todas sus cosas afuera, pueden seguir operando de fuera, se les recomienda también que pueden hacer eso. Pero para aquellos que quizás no podían o no tenían el lugar suficiente, ahora empezando hoy pueden abrir al 25% de su capacidad. Sí quiero mencionar ahorita que estamos hablando sobre las barberías y salones de bellezas. Una pregunta que se hizo la semana pasada, que por qué no podíamos abrir otros servicios personales. Bajo el nivel morado, los salones de belleza y las barberías pueden reabrir en el interior, pero no se pueden abrir otros servicios. Y la razón por eso es porque eso requiere que cuando están cortándole el cabello a alguien, trabajan la mayor parte con la parte posterior de la cabeza hacia el estilista. Esto significa que es menos probable que cada uno respire aire directamente exhalado por la otra persona. Entonces, quería tocar sobre eso, porque otros servicios como salones de uñas no están abiertas. A partir de esta semana, la ciudad se está alineando con el Departamento de Salud Pública de California en su método para calcular la tasa de positividad en Long Beach. Este nuevo método de cálculo incluye solo los laboratorios que se ingresan electrónicamente en el sistema CalReady. Ahora voy a compartir una actualización sobre los datos más recientes disponibles sobre casos de hospitalizaciones y muertes. Quiero recordarles que podremos esta información en el panel de datos de la ciudad disponible en nuestro sitio de web COVID-19 en la página longbeach.gov/COVID-19. Eso será muy pronto. Pueden visitar esa página para la información. La imagen número 2 que se mostró eran casos por fecha del episodio. Esto, como mostraron en la imagen, experimentamos un pico en los casos a mediados de julio a principios de agosto. Sin embargo, desde entonces hemos visto una disminución constante, lo cual es una gran noticia. Imagen número 3 habló sobre casos por 100,000. Esta imagen mostró la cantidad de casos de COVID-19 por 100,000 habitantes. Long Beach está representado por la línea azul clara con una tasa de casos de 2,296 por 100,000. La línea azul oscura es el estado y la línea amarilla es el condado de Los Ángeles y la línea gris es la ciudad de Los Ángeles. Este es el número acumulado de casos por 100,000. También imagen número 4 mostró las muertes por 100,000 personas. Nuevamente, Long Beach estaba en la línea azul clara. Nuestra tasa de casos por 100,000 y muertes por 100,000 han sido constantemente más bajas que en el condado y ligeramente más altas en comparación con el estado desde el comienzo de la pandemia. Imagen número 5, hospitalización activa a lo largo del tiempo. Las hospitalizaciones se informaron a diario, pero con el tiempo las cifras cambian a medida que recopilamos información más actualizada después del informe original. Hace 3 semanas, el promedio de hospitalizaciones de los últimos 14 días era de 77.9 y ahora es de 58.8 hospitalizaciones promedias. Eso es más buena noticia. Esto nos muestra que estamos viendo menos personas con graves enfermedades. Imagen número 6 mostró tendencias de hospitalizaciones. Actualmente, el 60% de nuestras hospitalizaciones provienen de nuestra comunidad. A principios de julio, ese número era aproximadamente del 50%. Entonces, esta tendencia continúa, donde estamos viendo una mayor parte de casos de la comunidad y menos de centros de atención a largo plazo. Como habíamos mencionado anteriormente, la mayoría de los casos cuando empezó esta pandemia venían de centros de atención a largo plazo y ahora ha cambiado. La mayoría de esos casos vienen de la comunidad. Entonces recordemos que reuniones y esto no lo haga. Además, seguimos preparándonos como ciudad para los aumentos repentinos de nuestro sistema de salud. Imagen número 7, información de hospitales de Long Beach. Ahorita tenemos el 50% de nuestras camillas en uso en los hospitales aquí en la ciudad de Long Beach. Tenemos 333 camillas disponibles para agregar en caso de una emergencia o un incremento de números de camillas necesitadas. También se mantienen las 100 camillas dentro del centro de convenciones de Long Beach para una emergencia y el 47% de los ventiladores ahorita están en uso. Nuestra capacidad hospitalaria continúa estable y adecuada. Seguimos teniendo un número suficiente de ventiladores para satisfacer la demanda actual y futura por si se ocupan. Imagen número 8 era el inventario de equipo de protección. Ahorita en el inventario tenemos más de 1.63 millones de equipo para la ciudad y hemos distribuido desde el 11 de marzo más de 677,000 equipos de protección personal. Nuevamente, esas medidas nos ayudan a comprender qué está sucediendo con el virus a nivel local y nos permite tomar decisiones clave para la ciudad. Imagen número 9, los niveles y medidas de indicadores. Como mencioné anteriormente, tenemos 4 niveles. El nivel número 1 es el más severo, que es el morado en el que estamos. Estas métricas están vinculadas directamente con la tasa de enfermedad en la comunidad. Algunos de los indicadores anteriores estaban más relacionados con la capacidad de respuesta del sistema de salud pública y de atención de la salud, lo cual fue fundamental al comienzo de la crisis. Los cambios en esos indicadores significan ahora solo 2 métricas determinarán la preparación de un condado para pasar al siguiente nivel. Esos son los nuevos casos por 100,000 por día y la prueba de positividad, o sea, un promedio de 7 días con un retraso de 7 días. Las áreas en el nivel morado como Long Beach y el condado de Los Ángeles aún tienen un riesgo significativo de transmisión comunitaria del virus COVID-19. Como mencioné anteriormente, el nuevo sistema por niveles analiza los 2 indicadores para determinar cuándo pueden reabrir los condados. Como parte del condado de Los Ángeles y junto con la ciudad de Pasadena, que también como la ciudad de Long Beach tiene su propio departamento de salud, tenemos que cumplir con los criterios de ambos indicadores para pasar al siguiente nivel. Mencioné anteriormente que aunque tengamos uno de esos indicadores que llega a otro nivel, las 2 tienen que estar para poder movernos. Y tenemos que estar por 2 semanas para poder calificar para mover al siguiente nivel. Aunque nuestras cifras se combinan con las del condado de Los Ángeles y Pasadena para determinar nuestro nivel, aún nos gustaría compartir cómo nos está yendo con nuestros indicadores aquí en la ciudad. El primer indicador es la tasa de positividad. Entonces vamos a hablar específicamente sobre los números de la ciudad de Long Beach. Antes de implementar el nuevo método para calcular la tasa de positividad, pueden ver que Long Beach ha experimentado una tendencia a la baja en la proporción de casos positivos en los últimos 2 meses. Imagen número 10 mostró la tasa de positividad en los últimos 60 días y se ve que va bajando. El gráfico mostró que nuestra tasa de positividad ahorita es del 4.6%. La ciudad de Long Beach está avanzando a pasos agigantados en este indicador. Todavía se nos considera en alto riesgo de transmisión comunitaria generalizada de COVID-19 debido a nuestra alta tasa de casos, que es nuestro segundo indicador. Imagen número 11 mostró la tendencia de la tasa de casos en los últimos 60 días. La tasa diaria de casos nuevos por 100,000 personas para Long Beach es del 9.5. Recordemos que mencioné que para el condado es 10.2, entonces estamos un poquito menos que el condado, pero todavía no llegamos para calificar a otro nivel. Mencionó el alcalde que aunque nosotros nos separemos del condado, no calificaríamos para movernos al otro nivel. La ciudad de Long Beach ha experimentado una tendencia a la baja en los casos nuevos diarios durante el último mes. Todavía tenemos más de 7 casos nuevos por cada 100,000, que es lo que nos mantiene en el nivel morado. Somos la segunda ciudad más grande del condado de Los Ángeles, por lo que nuestros esfuerzos a nivel local ayudan a impulsar las cifras en el condado en general, por lo que es importante que continuemos haciendo lo que podamos para reducir la transmisión, para que podamos avanzar con la reapertura de nuestra economía. Bajo el nivel morado, como mencioné, eso también ya lo cubrí, que cuando estamos en el nivel morado, los salones de belleza y las barberías es lo único que el que se puede reabrir. Entonces, estamos a lo máximo que se puede abrir en el nivel en lo que estamos. Los restaurantes, otros negocios no califican para poder reabrir. Entendemos el impacto devastador que tienen los cierres en las empresas pequeñas y locales, y aunque se ha dicho, quiero reiterar que estas decisiones no se toman a la ligera. Este conjunto particular de revisiones provino del Estado. La ciudad de Long Beach apoya la estrategia de reapertura del gobernador Newsom. Estas elecciones se tomaron tendiendo la salud pública como la máxima prioridad. Voy a hablar ahorita sobre la orientación para campamentos de día y cuidado infantil y protocolos escolares para cortes. Quiero compartir rápidamente información sobre las nuevas pautas que afectan a los niños en los campamentos y las guarderías. La ciudad de Long Beach está adoptando las pautas del Departamento de Salud Pública sobre el uso de cohortes para campamentos durante el día y centros de cuidado infantil. Un cohorte es un grupo consistente de niños o jóvenes y adultos supervisores en el que los adultos supervisores y los niños permanecen juntos para todas las actividades y evitan el contacto con personas fuera de su grupo. El uso de cohortes minimiza la cantidad de personas expuestas si se identifica un caso de COVID-19 en un niño, un joven o en un instructor. Las cohortes deben ser lo más pequeño posible, no más de 14 niños o jóvenes y 2 adultos en el personal. Los programas deben evitar cambiar las asignaciones del personal, y todo el personal y los niños mayores de 2 años tendrán que usar cubiertas para la cara mientras que están en el cohorte. Estas pautas también afectarán los programas escolares ya una vez que puedan reabrir. Para terminar, quiero mencionar que los centros con aire acondicionados estarán abiertos el fin de semana del Día del Trabajo. La ciudad de Long Beach espera un caluroso fin de semana del Día del Trabajo con temperaturas récords el domingo. Estamos activando 5 centros de enfriamiento con aire acondicionado en Long Beach el sábado 5 y domingo 6 de septiembre, desde el mediodía hasta las 6 de la tarde. Estos centros estarán en Admiral Kidd Park, localizado en 2125 Santa Fe Avenida, Houghton Park, localizado en 7301 Myrtle Avenue, Long Beach Senior Center, el centro para adultos mayores, en 1150 East 4th Street, y McBride Park, localizado en el 1550 Martin Luther King Avenue. Y la última localidad es en el Parque Recreation Park, que será en 4900 East 7th Street. Todos los centros operarán de conformidad con las órdenes de salud Más Seguro en Casa para prevenir la propagación de COVID-19. Se requerirán exámenes de salud, controles de temperatura, distanciamiento físico y también cubrirse la cara. Reconozca los síntomas de las enfermedades causadas por el calor, como mareos, náuseas, dolores de cabeza y calambres musculares. Durante las altas temperaturas, las personas, por favor, deben recordar mantenerse hidratadas bebiendo agua antes y después de cualquier actividad al aire libre, y trate de evitar bebidas que contienen cafeína o alcohol. Al entrar el fin de semana del Día del Trabajo, quiero recordarles a todos que deben celebrar de manera segura y responsable. Estamos progresando como comunidad y esperamos seguir viendo mejoras en nuestros datos. Recuerde usar una cubierta para la cara cuando esté en público y limite sus interacciones con otras personas fuera de su hogar. Esto es todo por hoy. Les agradezco que nos hayan acompañado. That is all for today. We thank you for joining.